Thank you. It is great to be here, and congratulations to the Petrie-Flom Center, to Einar and Glenn and Susanna, and this wonderful 20-year anniversary, and on fulfilling your incredible mission that I was delighted to be a part of. I was so grateful after my CDC departure in 2023 to find a home here at Petrie-Flom. I was clearly a law school outsider, and this place was very foreign to me. I spent 30 years at Mass General and 25 years at Mass General and Harvard Medical School, and I'm embarrassed to say I'd never stepped foot in the law school. I received a lot of emails from the center. I knew of Petrie-Flom Center, but while I was sitting in my little perch at MGH, I had little opportunity to engage and to leave the silos that happen here at Harvard and to leave the hospital and leave the medical school. So as a fellow, I had the opportunity to learn and I hope to give back. So you asked, why did I pick the law school? That is what everybody asks. Why would you go to the law school? And the answer was, while I was at CDC, I would frequently look at the Zoom screen and say, there are more lawyers on the Zoom screen than there are doctors and epidemiologists. And I was clearly new to the law, and I thought that there was a lot that I could learn by coming here. My time here as a fellow, and even now, has been nothing short of humbling. I led a 2.5-hour seminar while I was here with 2 L's and 3 L's, whose command of legal cases, statutes, regulations, and precedents far surpassed my own. But my role there was to explore the implications of things like how HIPAA can hinder good medical care and public health, or how incarceration policies, or as Sam discussed, the Braidwood decision, would literally on the ground impact my patients who are at high risk of HIV infection, or how unionization in our healthcare residents that is happening right now, our medical residents, are creating challenges at the bedside. In truth, I think I've learned far more than I gave, but at the end of the semester, I received a lovely card from my students, which I still have, about the impact that I had on them, which I found astounding given how little I knew about the law. So my one message to students is leave your comfort zone, because there's so much to be learned at the intersection of disciplines. I used to think that a multidisciplinary conference was when infectious disease talked to cardiology, but in fact, it is when infectious disease doctors move and go to the law school. I will say, even after my semester here, I was clearly nowhere near ready for meriting a law degree, and I definitely can't speak with any of the authority and deep expertise that you heard from the prior speakers here. So I figured I would talk mostly about health and some of its intersection. When I was appointed director of CDC in January of 2021, the headlines were not always kind. The big one said that I was a political outsider, and I lacked government experience, and candidly, that was true. I had spent 25 years at the bedside, and I would candidly say I had never walked into a room. I've seen thousands of patients. I have never walked into a room and asked somebody how they voted. It didn't matter. The CDC was founded in 1946 and has been chronically underfunded to accomplish the tasks for which it's responsible. I think that's probably pretty uniformly clear. By its 74th year of existence when I arrived, the CDC had never tackled a public health disaster like COVID-19, effectively affecting 340 million Americans all at once. There were 4,000 people who were dying every single day from COVID-19 when I started, and I took the directorship of a weary agency. Decisions only reached my desk when there were only bad answers to choose from and sparse data to guide them. I left the agency after 2.5 years of tenure, having assisted in an effort to put 700 million doses of vaccines into arms, an effort that has been projected to save 3.2 million lives. Now, while I was at CDC and after I left, and Glenn and you and I have had some YouTube conversations about this, I kept coming back to the same concern: how fragile our public health system really is, how unprepared we are for the next threat that is coming. Specifically, our need for continued investments in a rapidly deployable and response-ready public health workforce. a CDC-centric and nationally connected reference laboratory system, and integrated and defragmented national data systems. Our times now are much more concerning than a simple lack of political and financial support for public health. So let me give you a few examples that kind of literally keep me up at night, maybe ones that haven't been on your radar. Syphilis. Syphilis rates in this country are the highest they have been since the 1960s. Penicillin, its treatment, which should be cheaper than the tube it runs through, is in shortage in many places. And last month, New York City reported that they have had 3 infant deaths from congenital syphilis. Earlier this year, the STD laboratory and reference and research branch at CDC was closed for lack of funding. The next one is influenza. So in 2023 and 24, the threat looked like it was going to be avian flu. Many, more than 1,000 dairy cattle herds in over a dozen states were hit, and over 70 people got sick, and in fact, there was 1 human death. Today, avian flu has faded from the headlines, but it's seasonal, and migratory bird patterns are coming, and we need renewed vigilance this fall. And as respiratory virus season is upon us, at the same time our ties with the WHO are expiring, CDC is currently receiving 76% fewer isolates from around the world to sequence than they did a year ago today. We are losing our line of sight. Last year, CDC reported 266 pediatric deaths from influenza, the highest number in 15 years. Measles. So I'm going to go back to measles in 2014 in California, because I think that this is a really important example. An unvaccinated 11-year-old California resident spent 2 days in Disney in Christmas time in 2014. And by December 28th, she was hospitalized for measles with 4 more cases that were diagnosed that same day. By February 11th, right after the holidays, there were 125 cases of measles in 7 states associated with this outbreak, 39 of whom had attended the Disney National Parks. Others were secondary, tertiary, and onward cases. Now, that Disneyland measles index case was actually never identified. They sequenced the virus, and it looked like it was genetically matched a recent outbreak from the Philippines, so likely a traveler from the Philippines. And under-vaccination in California was felt to be the underlying cause, which prompted a new California Senate Bill 277 that removed the personal belief exemption for vaccination. That bill is credited for increasing MMR rates of vaccination statewide by 3.3% and by 4.3% for incoming kindergartners. Notably, non-medical exemptions decreased by about 2.5%, but medical exemptions barely went up. They only went up by about 0.4%. So now let's move from 2014 to 2025 and from California to Florida, the home of the other Disney. In 2024 to 25, 88.8% of children entering kindergarten in Florida were vaccinated with the MMR vaccine. Consider a reversal now of school mandates and what that will do to erode that number. Consider that we need 95% coverage everywhere, not just on average, for herd immunity in measles, and that 20% of Florida's population is over the age of 65, and that Florida is home to the other Disney, and that it ranks only second to New York in international tourism above California. Now, one other side note, and that is I happen to currently be studying for my infectious disease boards, which expired while I was at CDC. I love it. And everyone is saying, and I have seen 1 case of measles in my 30 years of practicing infectious disease, 1 in my career, and everyone is saying on the infectious disease boards expect a lot of cases of measles because our clinicians haven't seen it, they've never seen it, but they can expect to see it in the future. So I want to conclude my remarks by talking about vaccines and spend the rest of my time talking about vaccines. I want to emphasize that right now there seems to be this clear nexus between the narrative around the perception of CDC's performance during the pandemic and the treacherous place that we currently find ourselves. The shortcomings of CDC, both real and fictional, during the height of the COVID-19 pandemic are being used as a pretext to dismantle both the agency and the programs that ensure that Americans have access to life-saving vaccines. HHS leadership is inching towards a complete vaccine takedown, incrementally chiseling away at our previously trusted systems, leaving behind a shaky, fragmented vaccine facade that is increasingly obscure and untenable and has already limited vaccine access. Numerous steps have been taken, and some of them have been discussed, but I want to outline them for you so far. So, restricting COVID-19 vaccine access by age and by risk factor. That one's made the headlines. Withdrawal of $500 million of BARDA funding for mRNA research. Dismissal of all 17 members of the Advisory Committee on Immunization Practices and replacing them with a panel of known vaccine skeptics, and then firing CDC Director Susan Menares, who will appear in front of Congress on Tuesday, for refusing the wholesale acceptance of the new panel's recommendations. Sowing doubt and confusion into who should get vaccines. There was a posting by HHS on X that noted that pregnant women would no longer be eligible for the COVID-19 vaccine. And their own FDA commissioner had just that week prior published something in the New England Journal that actually stated that pregnant women are on the list of underlying medical conditions that increase the risk of COVID-19, of severe COVID-19. Instilling fear. If people followed the advice of the American Academy of Pediatrics. Now, you may recall that the American Academy of Pediatrics recently recommended vaccination of children between the ages of 6 months and 2 years. And soon thereafter, HHS posted incorrectly that recommendations that diverge from CDC's official list are not shielded from liability. So that are the things that may have been very public. But there are two other areas that I want to talk about that most doctors even do not know about. What's less visible is the plans for the Vaccine Injury Compensation Program. So the Vaccine Injury Compensation Program was created in 1986, and it is a pillar for vaccine policy, and it compensates the occasional, rare, adjudicated, but serious causes of true vaccine injury. We recognize these do occur. But it also protects the vaccine makers and manufacturers as well as healthcare providers from most liability. Without it, historically, manufacturers have stopped producing vaccines, and they very well could again. And then finally, equally at risk is our Vaccines for Children's program. Before I left CDC, I wrote about how we desperately need a Vaccines for Adults program to mimic one for the Vaccines for Children's program. But let me tell you a little bit about the Vaccines for Children's program. This was a program that was created in 1993, and it provides under and uninsured children free access to the pediatric vaccine schedule. And it covers the full schedule. It covers 19 diseases. It is credited with preventing 472 million pediatric illnesses and saving $2.2 trillion. Now, the Vaccines for Children's programs now faces a review by our newly formed ACIP, whose task it is to, quote, scrutinize the schedule of pediatric vaccines. And in fact, next week on Wednesday and Thursday, you will hear about the first one, and that is hepatitis B. And all signals are anticipating that the hepatitis B vaccine will be removed, the birth dose will be removed from the schedule. Since the Vaccines for Children's program supplies vaccines for half of America's children, the stakes for this vaccine schedule could not be higher. I want to just describe one effort where I'm spending a lot of my time, and I want to sort of double down on the point that Sam made, because I'm spending a lot of time there, but Sam's point really resonated, which is nothing can take the place of what CDC and the Advisory Committee on Immunization Practices does that is outside the government. The natural home for this work has to be in the government, and I can explain a little bit why. But in the interim, what some colleagues and I at University of Minnesota have started work on is what's called the Vaccine Integrity Project, and I would invite you to go to the University of Minnesota CIDRAP website, the Center for Infectious Disease Research and Policy. This is a program that we started where we just started with a conversation to say, this was back in March and April, to say, what do we think people are going to need in this era when we have someone who does not support vaccines as our secretary? And we started doing listening sessions with all sorts of different stakeholders. It was industry, it was state and local health departments, it was medical societies, it was hospitals, it was insurers, to say what would be needed if our vaccine infrastructure in this country tumbles. Where can we fill the gap? We heard from a lot of people, and as we were doing those listening sessions, ACIP was all fired, and we said, okay, we probably hit that trigger where we need to do something. What the Vaccine Integrity Program has done right now in a pilot phase is to try and provide the evidence for respiratory virus season. So in, I would call it peacetime, what generally happens is there's a CDC working group that compiles all of the evidence for how our vaccines are working, RSV, COVID, influenza, in preparation for the respiratory virus season. We took that on. We said, okay, the last time ACIP reviewed this was about a year or two ago, and we brought in 25 investigators from around the country who are donating their time and have reviewed 17,000 abstracts, whittled it down to 1,500 papers, and now have extracted data from 600 papers, all double reviewed, all with risk of bias assessments, all of which was publicly reviewed in a webinar that's posted on the Vaccine Integrity Project website, and all of this, as soon as this is complete, we're in the near final stages, as soon as it is complete, will all be posted so that the public can see the data behind why these vaccines have demonstrated efficacy, can see an unbiased view of the safety data. All of the links for every paper, I'm hopeful, will be on an app that will be available through the Vaccine Integrity Project. All of that said, what Vaccine Integrity Project can't do is get data from our vaccine adverse event reporting system, or hear from industry sponsors or industry on proprietary data that are coming in, or require vaccination once a recommendation is made. So we are putting the science out there. The societies are putting out their independent vaccine recommendations. It is American Academy of Pediatrics came out, American College of OBGYN came out, Infectious Disease Society of America will be forthcoming to make those recommendations at a time where I'm pretty convinced that we will not be able to trust the CDC recommendations, very sadly. So I want to just close by thanking the Petrie-Flom for the home I found here as a fellow in 2023, for the colleagues and friends I met here and that led me back to you this evening. I do want to leave you with just a few words. In today's very divided and polarized America, there is one consensus that actually remains. 92% of parents vaccinate their children. There's an old saying that we always say, vaccines don't save lives, vaccinations do. And unless we take action and quickly, you may be lured into believing that we have vaccines, but in fact, vaccinations themselves may become far out of reach. So I reminisce about those quaint days when lack of support for public health was our biggest problem, when we worried about the pandemics of tomorrow. Now I fear because we actually have to worry about the pandemics of yesterday. Thank you.
So now we have a couple minutes for questions. Maybe I'll start with a quote. A lot of people have questions. Maybe I'll start with a quick one, which is just to say, I've been struck at how disability phobic much of the anti-vaccination discussion is now, in particular connected to autism and neurotypicality. I'm curious whether you feel like that's always been there, or this is an amplified thread now, whether you have any thoughts on that.
I mean, similarly, maybe not specific to that point, but similarly, I have been struck at how hard it has been to get the organization of a lot of different organizations to have one unified loud voice, whether it's the societies or the autism community or whatever it is. But I think there's a lot of fear of speaking out against this administration, and I have seen that time and time again. Like, now is the time where we have to change our practices. I know this isn't standard fare. I know that this isn't how you generally do things. This is not generally your manual of operations. But we're not in standard times, and something new and different has to be done. And I've been encouraging people, societies for large, to do that.
Hi there, my name is Clarissa, and it's been an honor to be able to speak with you right now. I was an emergency department nurse during COVID-19 and throughout, so I've seen directly how it affected my patients. Now I'm a clinical research nurse because of my patients working with pediatric infectious diseases and COVID-19 vaccine. So my question for you is, how can we restore trust on us from our patients to the public health system and medicine? And then how, maybe this is like a $1 million question, but how can we make health apolitical? Because the only people who get hurt are our patients. Thank you.
So I think, one of the things there's a lot there. It is hard to get your voice out when you don't have the megaphone. Right now, it's actually been really hard to sort of get messages out, and we're trying to do it through societies in other ways. Many people have said, how come all the societies are going against the CDC right now? And the answer is, actually, the CDC is the only thing that's changed. It's the societies and the medical professions that have all stuck together. And so a lot of what I've been doing is saying, okay, so look at all the other medical societies, look at your hospital website, look at the AMA, pick your medical society, but the medical profession is actually pretty stoically consistent, and it is this flip at the CDC that is different in this moment. When people ask restoring trust, my answer to this 6 months ago might have been different than my answer right now. I will say, though, that there's a lot of trust that we have in public health that people don't realize. Now, we're all drinking bottled water, but if you washed your teeth with the tap water this morning, you're trusting some public health. And if you go eat at a restaurant, you're trusting some public health. And so I would like to, when we say how can we trust public health, I used to say when I was at CDC, we're regaining trust, and we did while I was there. When CDC was not the subject of the news, we were reporting the outbreak. And unfortunately, what has happened again in this administration is the CDC has become the subject of the news. They have become the places where bullets get shot. They have become, the news where their director gets fired. So it has become the subject again, which is a huge problem and very intentional problem.
Hi, my name is Alex. I'm a medical student at Harvard Medical School. I had a two-part question. The first one is, you mentioned getting out of these silos. What can current medical and law students do right now in terms of addressing some of these issues in collaboration and learning about them? My second question, at a bit of a broader scale, is what's the role then of organized medicine, like the American Medical Association, the American College of Surgeons, in also addressing some of these issues? Thank you.
Yeah, I think the consistency of message is going to be critically important, and not worrying about where things on the margin might be. We think the doses should be given 8 months apart rather than 6 months apart. Tell people to give the doses, right? Because we get in the weeds of our own super specialties, and I think we have to be consistent as the medical profession in this moment. With regard to what you can do to get out of your silos, you have an elective rotation, spend at the law school. I bet none of your colleagues do that, right? So there are ways that we have to, I actually will say, when I was in medical school, I never went to the School of Public Health. So even that, we are so pre-programmed to sort of stay within our boundaries. My husband had a student who did a rotation at the zoo. This is generally a land of yes when it comes to doing something creative that's academic. There may be other lands of no that we live in, but this is generally a land of yes if you can sort of be motivated to do something cool and creative in a different space, and that's what I would actually advise you to do.
I think we have time for one more question.
Thank you so much for your presentation. But I think that there's somebody who back there maybe. Yeah. Okay. So you're an infectious disease doctor, and what I'm seeing is more than just an attack on vaccines, but a deprioritization and even skepticism about the germ theory. I mean, I don't want to go that far, but to what you ascribe, philosophically, ideologically, politically, this turn away from infectious disease as a primary threat to American health and an embrace of what is termed to be chronic disease.
Well, the answer will be the last question. We have one answer for both. Yes, quickly. Yep.
Yes. Madam, I am from biology department. So a very interesting talk. My question is very basic. Prior to pandemic, I have read that anywhere from 5 to 10,000 people died each year on account of flu. But after the pandemic, even today the COVID continues, but the number of deaths is hardly any, very, very insignificant when compared to the flu that occurred before pandemic. So in your opinion, do you think that the people have developed immunity due to vaccination or what you call herd immunity, as suggested by once the Florida governor?
Great. So we want to answer those two questions, Dr. Walensky.
Okay, so I'm going to start with the second and just say, during the pandemic, flu deaths went down. We generally have better and worse seasons of influenza. On average, we can get somewhere between 20,000 and 50,000 deaths a year from influenza. During the pandemic, that went down probably from lack of exposure. And then it actually went up again from, so there are confounding issues, like is it a good season or bad season? How well is the vaccine matched? How well did we do in vaccinating our population? But I think we're actually pretty close to back to steady state. In fact, last year we had the highest number of pediatric deaths that we've had in over a decade. So I think we're pretty close to back to pre-pandemic steady state of how influenza is going. Go get your flu shot, don't forget your flu shot, and your COVID shot. And then the other, so, it's actually a really curious, I've been spending a lot of time listening. There's a great actually podcast called Why Should I Trust You with Brenda Arakaria. And I almost like sometimes want to throw my phone out the window, but sometimes it really has folks from AHA talking to folks from health and public health. It's curious to me that someone can claim that and there's a lot of language, like gold standard science, transparency, all the words are good, and you lift up the hood and it's empty. So things like, we really want to focus on chronic disease. The chronic disease side of the CDC house has been almost eviscerated. The injury program is on the chopping block in the 2006 budget. The PRAMS program for maternal mortality surveillance has been, so they keep saying what they want to do. And I'm not going to be the first to say that every one of these programs was perfect and that we shouldn't do better, but it's been dismantled without a plan to do better. And that's what I don't understand. So while they're saying they're focused on chronic disease, they've dismantled the CDC part of the chronic disease. AHA, the Administration for Health, or whatever it's called, for Healthy America, I don't see that in sight. And yet the infectious disease side has also been really, I think leaving the WHO, there's an active Ebola outbreak ongoing in DRC right now. So there's like all these different areas. So I think it's actually both sides. He's talking about chronic diseases, but actually not doing a lot about chronic diseases. Yes, food dyes, but if you look at the deaths caused by food dyes, it's much less than many other things.
Big round of applause to Dr. Walensky and for all her keynotes.